Breast augmentation is a procedure that we use where we basically take a breast implant, either silicone or saline, and place it in a position behind the person's muscle, pectoralis muscle, or simply behind the breast tissue. The women who come in desiring breast augmentation span a very wide age range, and it's all the way from young women who have small breasts who desire to have them bigger to a middle-aged woman who, following childbirth, has had sagging breasts or has just had a simple decrease in breast size and wants to, get their breast size back that they had always had. Some of those patients also will fall into a lift category where they've lost volume and they have excess skin, in which case we'll place an implant at the same time that we do a lift to make their breasts look better and also reestablish the volume that they had. There are four basic approaches or four ways to place an implant, and those are through the armpit or the axillary incision, through the nipple or a periareolar incision, through an incision underneath the breast, and then lastly through an incision in the belly button. I have learned all four of those approaches and will put implants in through any of those approaches. Now, we can put in either a saline or a silicone implant, so depending upon what the patient wants and desires, sometimes the choice of the implant will dictate the incision. For instance, it's very difficult to put a silicone implant in through an axillary or an armpit incision, so they need to be put in through an incision around the nipple or an incision underneath the breast. Saline implants can be put in through the belly button incision or through an axillary incision or through the inframammary or periareolar incisions. Probably one of the most difficult decisions that most women have when they choose an implant is how big of an implant do they choose. And implants come in three shapes, and that is they have a high profile, a moderate profile, and a low profile implant. Looking at each one of those individual profiles of the implants, it's interesting that as implants get bigger, they only stick out a small amount more as they increase in size, but they get very much wider. So the basic approach to this is sort of an anatomical augmentation. We'll choose an implant that matches their width or approximates their width, and then pick the implant size based upon that. Once we have some sense of the size of the implant, we allow the patient to try the implant on so that they can get a sense about what is 500 cc's or 400 cc's and see if that's sort of what they were thinking. All of the procedures are done under general anesthesia. The average length of the procedure is anywhere from 30 minutes to an hour. And recovery time is usually pretty quick. I would say that any implant that's placed under the muscle, the recovery is a little longer than if you place it on top of the muscle. But most of the patients we do on a Thursday or Friday go back to work on Monday. The ultimate outcome of the procedure is it always takes a while for the implants to settle, for the pocket to sort of loosen up and let the implant fall behind the breast tissue. And that final result probably takes 3 months, although most patients at 3 to 4 weeks are very happy with their appearance. Actually, they're very happy with their appearance immediately, but they get to like it a whole lot more at a month and certainly much more at 3 months. So with breast augmentation, the 4 incisions that we use, just that 2 of those incisions are what we would call endoscopic incisions. So the incision through the belly button and the incision through the armpit, we nowadays use an endoscope to do. The armpit incision has been on a long time, and there's a certain number of physicians who still do that as a blind operation. I think the biggest advantage nowadays is the use of an endoscope through that incision. The endoscope allows you to make the incision, or once you've made the incision and gotten into the pocket behind the muscle, again we can put a TV camera in and we can dissect the pocket exactly where we want. In the past, or even today, a blind transaxillary augmentation, meaning one done without an endoscope, the implants will end up too high in, say, 10% of patients. With an endoscope, the implant malposition rate is probably somewhat less than 1%. The transumbilical approach, again, another endoscopic approach. In that case, it's very reliable to put the implants in a pocket above the muscle, and a little less reliable to put the pockets below the muscle because we don't have the endoscopic equipment that allows us to visualize the muscle as we cut it, so a certain part of that procedure is blind. However, again, with the exception of that one blind part of the procedure, that in the right person is a great way to place implants. You know, as I mentioned, when we're choosing implants, we like to do an anatomical augmentation. So we like to have the implant width match the width of the patient, so that a woman who is 6 foot tall and a woman who is 5 foot tall can both be, quote, anatomically correct, end quote. There's different profiles of implants. So this is a moderate, or high, moderate, and low profile implant. Each of these implants is 300 cc's, but what you can see is that this implant is much narrower, so it sticks out more. So in some women that want to be, you know, larger on top, I'm going to steer them more toward a high profile implant because that's going to get them the look they want. Another woman who really doesn't want anybody to ever think that they had breast implants, but is maybe just wants to fill out her frame a little bit, may fall more into a low profile implant. Probably 80% of the patients will choose a moderate profile implant, and that'll get them their desired result. But this is helpful because every patient's group can be satisfied. We can end up, you know, taking care of the women who want to be, you know, a little on the top heavy side, all the way down to women who don't want to be top heavy at all, and all of them will have the same natural result.